You know, these GLP-1 medications are the bee's knees, guys. These are quite literally the most powerful medications that we've ever had to help you with your weight loss struggles. But the sad part of it is, many of you will not only achieve your desired weight loss goals, but you're going to struggle to maintain it. As you can see here in this randomized controlled trial, 70% of weight was regained after stopping semaglutide within a single year. Some of you are aware of that, and you'll just stay on the medication because you're freaked out and you don't know where to go and what to do, and you don't want to regain that weight with all that effort that you put forward. And many of you just accept it and have started to regain that weight or have already gained it all back. Trust me when I say I totally understand what you're going through. I lost 100 pounds over 20 years ago, and I struggled for over a decade to achieve stability in my weight. So I get it. In this video, we're gonna crack the code and get into some simple, easy to implement strategies that get to these underlying issues so that you can achieve lasting weight loss and medication independence. Yeah, lasting weight loss, it's such a frustrating concept, right? It's such a challenging thing for most people to achieve. And we're going to go over the statistics here and how bad they are, but just myself. So I lost 100 pounds. I was 16 years old. And I did this with the old school method, right? So this is before fasting. This is before GLP-1 medications. This was me counting my calories, counting my macros, 6 meals a day, cardio in the morning, weight training in the afternoon. I mean, it was a ton of effort. And I just thought that's what it took. You know, I was managing gyms at the time. I was a personal training manager, and this is what we did for our clients. And so that's just what I thought it took. And then I came across fasting, and I realized, okay, wow, all I did was, because I started with intermittent fasting, 16-8, all I did was implement 16-8. All of a sudden, it was easier. I had more stability in my weight. I wasn't maintaining leaner physiques. I was definitely maintaining closer to ideal body weights. Before, I was fluctuating 50, 60 pounds every single year. And after 1 year of intermittent fasting, I was fluctuating by like 20. Then I moved into more aggressive, longer rounds of fasting, which I will absolutely get into later in this video because I think it's an integral piece. Still no idea what I was doing in my physiology at that time. Now I understand this is all about fixing insulin resistance and lowering those chronically elevated insulin levels. And so that's what this did for me. And boom, I was able to maintain a physique, and that was just in a leaner range, and it was easier to maintain. That's the key, guys. Because I know just as much as you guys want to achieve lasting weight loss, if we really want to be specific, you tell me what you think. Really, we should expand on it. Lasting weight loss that is actually maintainable. It's one thing for someone to give you a set of instructions that are technically true by definition if you do them. But when it comes to lasting weight loss, it has to be something that you can adhere to. It has to be something that you can maintain. Really, we could even expand on that. And we can say, well, if you put a gun in my head, I could maintain that, right? So it has to be practical. It has to be something that you are willing to maintain. And ultimately, the easier we can make it, the easier that I have made it is, I think, why I've been able to crack the code on this and help people achieve lasting weight loss. It's never been easier than the way it is now because of the GLP-1 medications. Unfortunately, though, many of these GLP-1 medications, they don't incorporate the proper lifestyle interventions. And boy, oh boy, we're going to get into it, but you got people getting wrecked with side effects. You got individuals that are stuck in weight loss plateaus. They're barely eating 800, 900 calories. They look like freaking zombies. And I've made many videos like zombie mode is literally what happens when you are in a weight loss plateau. Your metabolism slows down. It downregulates because you're starving or you're just deficient of energy or micronutrient. You look like shit. You feel like shit. You might be happy because you lost weight, but you're stuck. You don't know where to go. And then people are getting wrecked by side effects too as well. And then not to mention, nobody has a solution for maintaining that weight loss without the medications for life. And by the way, this is because lasting weight loss has always been extremely challenging. And like I said, we're going to get into that. The consensus out there, they haven't really figured it out. Most doctors are following this cookie cutter protocol where people are just getting ramped up on their dose. I know this probably sounds all too familiar. Every 4 weeks, let's increase the dose. Well, in the studies, this is what they had to do because individuals were not implementing aggressive lifestyle interventions to anywhere, not at all, let alone to any extent that we're going to teach you guys here. But the reality is, if you had proper lifestyle interventions that got to the root cause of your issues, of your obesity, of your weight maintenance resistance, because it's not just an obesity thing, guys. Many individuals that are not obese still have these same issues with insulin resistance, and they're struggling to maintain weight loss or achieve weight loss. Truthfully, the GLP-1 medication, semaglutide or tirzepatide, you wouldn't have to get ramped up on such high of a dose if you also focused on proper lifestyle interventions. Before we really dig into the struggles with the current GLP-1 situation, let's dive into just lasting weight loss as a whole. You might be shocked to hear this. You hear my story and you go, okay, this makes sense. But lasting weight loss is extremely challenging. When you look at the data, more than 85% of people who have ever lost 10% of their body weight have failed to keep it off. I mean, let that statistic sink in. You got to be a literal unicorn to have successfully achieved lasting weight loss. So it's brutal out there, folks. This really tells us something. For me, we've been looking in the wrong location. We've been looking at the wrong problem, the wrong why. Why has obesity skyrocketed? And why is what we are doing not working? Because the primary focus has always been reducing your calories, increasing your exercise, but that shit don't work. And you know that. That's why you're here watching this video, trying to figure it out whether you've started your GLP-1 medications or not. You're trying to make sense of it. This is a real problem. What's even more interesting, in case you're asking yourself, what did the people do in the 15%? Like, what does it take to be a unicorn here? In case you're curious, it doesn't help us because that's the whole point of a unicorn, right? It's really challenging to be one. But they did studies on these successful weight maintainers. And lo and behold, what they found consistent were related to mindset. It was topics related to mindset. So consistency with monitoring their energy intake. So consistent calorie monitoring and consciousness, counting calories, counting macros, a good supportive environment, strategies to handle depression and anxiety before it becomes an issue, consistent exercise every single day, consistent caloric restriction every single day. So that's it, guys. That's all you got to do. It's not a problem, right? I just got to starve myself, exercise every single day, never get depressed, never get anxious, have a good support system, have a good buddy to keep me on track. That's all. Nothing crazy, right? Well, they call it, I'm calling it a unicorn for a reason here. I always like to say, if you guys know who David Goggins is, one of the most mentally tough individuals on this planet. And you can always mindset your way through something. You can mentally toughen up. And I really believe that, and this is a prime example of it, mindset could technically be everything in theory. But theory and practical application are different. And in practical application, most people are not able to at least consistently apply principles that would otherwise be needed, right? Because they don't understand as a whole the methodologies that have been standardized are not taking into consideration hormones, specifically insulin. There's more hormones that we need to understand over insulin, leptin, and some of the certain, like ghrelin, for example, that really trigger the hunger. But at the end of the day, the primary issue is hyperinsulinemia, which is chronically elevated insulin levels. And this is primarily produced by insulin resistance. And this is primarily driven by lifestyle, okay? So there are other contributing factors, and I have a great video on insulin resistance. You guys should go check that out on the YouTube page. You'll see it right there in the thumbnail, but it's a deep dive specifically on insulin resistance. And so you definitely will learn a lot by checking that video out. Here come the big bad GLP-1 medications. Why are these things the bee's knees? Why are they so amazing? Yes, they suppress your appetite. They suppress your food chatter. You probably already know that by now. They get you into a caloric deficit. But is that all they do? No, it's not. They do so much more. Specifically, what they're doing is they're reducing insulin resistance. We're going to get into a deeper understanding of insulin resistance here in a little bit. But for what I told you earlier, it's the insulin resistance which creates the hyperinsulinemia, and that's the primary problem that we need to focus on, that most of you guys, if you focused on, would handle your issues. GLP-1 medications have a combo effect of essentially forcing you to eat less and making your body more insulin sensitive. And by the way, guys, this is why these medications are just truthfully the bomb. We've never had something that we've had appetite suppressants. We've had powerful appetite suppressants, but never have we had a medication that gets to the root cause of anything. You think about most medications, they're just chasing symptoms. But now we have a medication that actually gets to the root cause of the weight issue to begin with, which, again, this is where the controversy exists. Maybe you think it's all about calories in versus calories out, and, good luck to you. When calorie restriction alone is all you need to do that works, it's because you're not insulin resistant. And so if you're not insulin resistant, if you don't suffer from hyperinsulinemia, then it really is a simple energy in versus energy out. Who the hell is not insulin resistant, significantly overweight, metabolically busted, inflamed, to the nth degree? I mean, that's just, you're not seeing that at all today. I mean, everybody is screwed up right now, stressed out through the gills, and, that's jacking your cortisol up, which is jacking your sugar up, which is creating more insulin resistance. So it's one of the reasons why I think medication is a must at this point. As a holistic practitioner myself, I've always been so passionate about trying to avoid medications, using more sustainable and holistic approaches. That's why, I get shunned just as much by the functional community as I may by the Western allopathic community, because by nature, by focus, if you don't know me already, that's our biggest passion is helping people achieve lasting weight loss, higher levels of health. And it's always been reducing prescriptions, preventing surgeries, when possible. But in this case, I think trying to fight this battle, and this is what I tell functional doctors all the time, like trying to beat this with lifestyle only, that's like asking, David to beat Goliath over and over and over. Like, it's just not going to happen when you run that experiment over and over. He might win 1 out of 100, 1 out of 1,000, but it's a really tough battle, And so I'm all for the medication because I think the side effect profile is well, I know the side effect profile is very minimal. And, the benefits of you being less obese, being less insulin resistant far exceeded in almost most cases here. The medication's great. Unfortunately, though, it's not all sunshine and lollipops. The thing is that these medications, unfortunately, do have a dark side. We briefly mentioned them earlier, getting wrecked by side effects. I truthfully think these medications are being used incorrectly. They could be used so much better. This concept of microdosing, intermittent usage, we have to understand why most practitioners and most doctors won't do that. They're, God bless them, respecting the data and respecting the literature. And here I am saying, I'm not saying don't do that, but I'm saying that there's a lot of robotic practice of medicine out there. In many cases, it's not the fault of the doctors. I mean, remember, these poor physicians barely have enough time to get the dosing right with their patients, let alone to coach them on lifestyle. They just don't have it within them. And you've been practicing for 20, 30, 40 years, and all you've had time to do is prescribe medicine. It's going to really jade you up, your thought process, your what you believe is possible and not anymore. So I don't even hate on the practitioners anymore because, they're doing the best they can. And many of them are starting to see the light at the end of the tunnel and doing one way, shape, or form some sort of lifestyle and wellness intervention coaching. But for many of you, you didn't get that. You didn't have that access. You didn't have that treatment. What you experienced is what the data shows, So they did the research on this medication, and in order for the effectiveness that we want, which is weight loss, effective weight loss, thorough, adequate weight loss, if you will, there was this need to continue to increase the dose, right? So if we're talking about tirzepatide, 2.5 milligrams for 4 weeks, then 5 milligrams for 4 weeks, then 10 milligrams for 4 weeks, then 15 milligrams for 4 weeks, with some variation. That's sort of the template. And then for semaglutide, 0.25 milligrams, then 0.5 milligrams, then 1 milligram, then 2 milligrams, or maybe 1.5, then 2.4. It's just like, we just do that. I had a gal on my live the other day who, because I go live, on various social media platforms every single day. And, she was like, my doctor, I increased my dose and I feel like shit now. I'm vomiting. I'm throwing up. Like, I feel awful. And I'm like, why'd you increase your dose? My doctor told me to do it. Why did your doctor tell you to do that? She goes, I don't know. I just did what the doctor said. I was like, understandable. Okay, well, let me ask you some questions. Did you feel really good before this? They're like, yeah. Okay. Was your appetite suppressed? Yeah. Were you making better choices? Yeah. I was exercising. I was losing weight. And I didn't have I felt a little nauseous at times. And now I'm just wrecked and I can't eat at all. And I'm like, what the? I mean, it's again, at the fault of many of these doctors. It's not their fault, but for some of them, it is their fault. And they do have an opportunity to at least create better templates, at least have something in writing that says, if you feel good, talk to me before, reach out to my clinic before just willy-nilly following this template that I'm putting out for you that most people will need to adhere to in my experience, but they don't even do that. So what I'm trying to say is there's these things you can do, right? Like there's these lifestyle interventions. They're so cool, by the way. We're gonna get into them, but in case you're curious, you're like, what the hell is he gonna talk about? It's not magical, but it might seem a little bit magical, So we got eating less processed foods, eating less carbohydrates, lots of deep fasting, lifting heavy weights, supplements. That's 5. There's 10 pillars. We probably won't get into all of them for this video, but those are the big 5. Those make a huge difference for most individuals. So doing the right combination of those lifestyles for you as an individual will also address, and much more, some of the underlying driving factors behind your weight loss and weight maintenance struggles, aka insulin resistance, inflammation being the big 2. And so when you do that simultaneously, which, by the way, folks, why would you not want to take advantage of things that are good for you? And presumably the only reason you don't do them is maybe you don't know what to do, but we all know it's like, stop eating junk food. Like nobody is like, oh my God, really? Like junk food's bad? Like, I don't know how many people haven't heard, because no one's arguing about the benefit of eating less processed foods. Functional practitioners, there's so much more that we know that can be done via lifestyle across the pillars that we talked about earlier that make dramatic improvement in not just ability to, fix the insulin resistance and lasting weight loss, just overall optimal health. Before we get into the solution, one final piece that I think is vitally important that we understand is just the root cause of obesity here. Obviously, shit ain't working with calories versus, energy in versus energy out. The carbohydrate insulin theory of obesity, I think, really answers all the questions. I have plenty of other videos getting into that. In essence, what I'm saying here is hyperinsulinemia is the true culprit. Why is that? What is it about chronically elevated insulin levels? It's really important that we understand this, by the way. It'll help you understand the solution better. But why is it so damaging? Why is it so bad? The reality is that insulin is the most powerful storage hormone in the body, period. So let that sink in for a second. It's not just the blood sugar regulating hormone that we all think of, but insulin is the primary driver of carbohydrates, sugar, but also protein and fat. It drives it into the cell. More powerful than testosterone, more powerful than growth hormone. Literal bodybuilders will actually inject insulin to help them build muscle mass, despite how dangerous it is, because a non-diabetic is very insulin sensitive, especially these bodybuilders. And so insulin can really cause their blood sugar levels to plummet. And so, but despite this, in their efforts to achieve massive, massive bodies, they will do something like inject insulin. Very, very powerful storage hormone that is senior and upstream to many other hormones in the body, by the way, including metabolism, including thyroid. So this is important to understand. In a healthy body, though, you're not supposed to have chronically elevated insulin levels. You're not supposed to be hyperinsulinemic. Insulin's function is supposed to be transient in nature, meaning short-term. You eat food, blood sugar rises, insulin rises in response, lowers the blood sugar, then insulin lowers. Cool, that's great. And if you're insulin sensitive, you could do that all day. Now, obviously, doing that all day, we talked about it earlier, eventually leads to the insulin resistance to begin with, but that takes time, and among many other factors. Lifestyle is not the only contributing factor to the development of insulin resistance. It's just a really big one. When you have this state where insulin is always elevated, you are in a constant state of storage. So you have to understand that, because this is where it gets really difficult for the whole idea of energy in versus energy out. And yes, energy in versus energy out is the end all be all. Whether or not you get into a caloric deficit and maintain a caloric deficit needed for weight loss, or a surplus for weight gain on the other side of the equation, is heavily influenced, not dependent, heavily influenced by your hormones. The elevated insulin can do two major things, and it usually does, to accomplish the goal, right? Storage. If you're eating in a deficit, but your body is trying to store into the body, but there's nothing to store, well, it's got to get something to store, guys. It's got to come up with a way to store. Well, how can we get you as a body, right? How can the hormone make the body store when you're not eating enough to begin with? Well, we can slow down the metabolic rate, and we know that that's a real phenomena. The influence of insulin over thyroid output. We talked about the weight loss plateaus briefly earlier. So we have a downregulation of your metabolism, but then we also have hunger. And I think that's the big one. I mean, they're both really, really powerful. And, hunger is extremely challenging to overcome unless you use things like GLP-1 medications. So GLP-1 medications can help us override that. But what they can't help us override is the potential downregulation of the metabolism. Hormones always win the battle. Basically, when it comes down to that battle about calories versus hormones, they both matter. It's just at the end of the day, focusing on insulin is a much more effective utilization of your time. I want you guys to understand that. How do we fix this? You understand insulin, you understand this state that we're talking about, the hyperinsulinemia and the impacts, what's causing it. Well, actually, if you want to really know what's causing it, that's my other video, insulin resistance. Go check that out. Basically, in a nutshell, lifestyle is the primary driver behind insulin resistance. Let's dive into that, and then we can segue into the part about how do we actually fix it. So lifestyle, meaning diet. Specifically, there's only three sources of calories: carbohydrates, protein, and fat. Fat has a very negligible effect on insulin. Protein has a moderate low, unless we're talking about protein powders. And carbohydrates, my gosh, it's shouldn't be much of a shocker. And, it sucks that most delicious things contain carbohydrates, but that's beside the point right now. So it's carbohydrates. The consumption of carbohydrates are the primary driver behind insulin resistance and ultimately the primary driver behind obesity and diabetes. And so decreasing our consumption of carbohydrates is the base, is the starting point of how you can fix this. Now, it's important to note that inflammation is also the secondary culprit behind insulin resistance. So let's talk about that, and then we'll put it together with lifestyle. Inflammation is, and you've heard, we've been talking about inflammation for how many decades now? The concept of chronically elevated inflammation levels are a driving factor behind all chronic disease, because you don't see elevated insulin levels in many healthy situations, unless it's an acute inflammatory response to maybe a sickness or a stressful event. So, which is completely normal and healthy, just like transient rises of insulin are normal and healthy. So we have these chronic situations, if you guys are noticing a theme here, that are not ideal for the body, but the inflammation, for all intents and purposes, will have similar impacts. Elevated insulin levels can put your body into a storage mode where your body wants to store nutrients. It's not the primary driver like insulin, but it also influences it. And it also has its own pathways in which it hinders the mobilization of free fatty acids, which, by the way, insulin does that too. So inflammation in its own pathways causes a lot of the same issues that insulin does, probably to a lower degree, but still very much worth mentioning. And mind you, hyperinsulinemia and inflammation are very parallel. They affect each other. As you become more insulin resistant, you're going to become more inflamed, and as you become more inflamed, you're going to become more insulin resistant, hyperinsulinemic. So working on one will improve both, but working on both will improve both more. And so that's what we're doing, and that's the primary focus with these interventions that we're about to get into. So Number one, I don't need to harp on this because we've already talked about it, eating less processed foods. Reduce your consumption of processed foods. They're full of toxic crap. They're full of carbohydrates. They're full of sugar and all the various things that jack up our blood sugar and jack up our insulin levels. And so replacing processed foods with whole, nutritious, think meats, vegetables, fruits, legumes, nuts. You would do really well by consuming a majority of these things. Number two, reducing your consumption of carbohydrates. Putting these two together, because we're both talking about nutrition, I like paleo and I like Mediterranean as a good starting point. If you need structure, really what I call this in our programs, because if you don't know, I coach patients. We do this every single day. We have the most robust platform for holistic approaches towards GLP-1 and lasting weight loss. Really, what we're talking about here is the anti-processed food diet. So the anti-processed food diet, paleo Mediterranean, but let's go keto. Let's cut out the carbohydrate source. Let's keep our carbohydrate intake. We can do like 60 or 50 net carbs. So fiber is okay. Take away fiber. And this is going to be very much very powerful. If you just did that alone, replaced your processed foods with whole natural foods, and you adopted a keto approach, a lower carb approach, you would do really well. But it's not enough for most of you. Or ketogenic diet is just difficult to adhere to. So that's the other piece of the equation, because if you remember, making it sustainable is more important than anything else, you could easily argue, right? So we get into fasting as what I consider probably the most powerful tool that we have, but these three things and then number four are all really, really important, and I hope you understand that. But what I created is the FLOA protocol, FLOA, fasting like our ancestors. I created structure where structure was missing in the world of prolonged fasting. So we start you off on an intermittent fasting regimen. So this is your 8-hour eating window. First calories in, last calories in would be your eating window, and the rest of every 24-hour cycle is fasting, including sleep. So really, we're just talking about not eating for 6 to 8 hours of the day. It's not that challenging. For most people, it'll get some results. For some people, it's just not enough. There's so much more meat on the bone. Don't you hate it when people leave a bunch of meat on the bone? I don't care about your financial situation, but let's clean that bone up. Let's get that meat off. Let's not be wasteful here. And this is like leaving a massive amount of meat. This is like taking one bite of that chicken leg and leaving the rest full of meat. We can't do that. Let's clean that bone up and let's get into some longer rounds of fasting. And that's exactly what we do with FLOA, is we add longer fasting. But instead of on a daily basis, because we're going 24 hours to 48, eventually 48, we do this one time per week. Now, when you're doing 24-hour, this is kind of like a stepping stone. So I'm okay with you doing that once, maybe twice a week. Get really comfortable with that, and then we're going to push it to the 48-hour. And that, anything beyond, so for example, if you're eating dinner on Tuesday night, 24 hours would be Wednesday night. You go to bed, that's a big hump right there. Going to bed after not eating all day. If you've never done that, it will feel really weird. Even on the GLP-1s, it's going to feel weird. Our society, we've been eating food for, I don't know how old you are, 30, 40, 50, 60, 70 years you've been on this planet. You've been eating food presumably every day, because this concept of fasting is just so barbaric, some will say, that, and we've all been stooped to thinking we need a high carbohydrate laden breakfast. But so yeah, a lot of you haven't done this. So this will be a big milestone, but I promise you it gets easier over time, especially if you're doing our program. We're going to have you on a fat mobilizing peptide. We're going to have you on tirzepatide or a semaglutide to make it easier. So once you get past that hump, you wake up in this scenario Thursday morning, last meal Tuesday night, you're already into 34-hour fasting territory. It's pretty awesome. So now all you got to do is you do that once a week and slowly work on increasing that to somewhere around 48. The truth of the matter is, I don't have a crystal ball. Maybe 34 is all you need. Maybe 24 is all you need. What I know for certain is this: weight loss is not a good metric that we're doing enough work here, because weight loss can be accomplished with just taking the GLP-1 and not doing any of the crap that I'm talking about. Let's keep it easy, right? But you've been there, you've done that, or maybe you have enough intelligence to realize that I need to do more. I don't want to be one of the statistics. And so that's why you're watching this. And if that's what you're thinking, then yes, all this effort that I'm creating for you, which is not that bad, by the way, this is because weight loss is the consequence of what we're trying to accomplish, which is low, non-existent insulin resistance. I just don't want you to be resistant to insulin. We want to restore maximal insulin sensitivity. We want to achieve nice, healthy, low levels of inflammation. We want to become very fat adapted. And like I said, there's a couple more things. We want to get your hormones balanced. We want to address any micronutrient deficiencies. I have a ton of other videos getting into more pillars, but these are the big ones. If you're wondering why, Dr. Jones, you're a madman, you want me to fast this long, this is why. You'll thank me later when you start feeling awesome. And you just ride that. You ride that wave. You're doing a 48-hour fast. People in our program, we have them doing that until they hit their weight loss goal. And, we're talking 50, 100, 150, 200-pound weight loss goals are so much more achievable when you're doing massive amounts of fasting. I mean, look at it this way. Let's say you're not doing fasting, long fasting. Let's say you're doing intermittent fasting, but you're eating every day. You're going to rely on calorie deficit, and you're going to be eating food every single day. Well, good luck losing 100, 200 pounds. I mean, not even talking about the fact that you're going to plateau well before you reach your goal in most cases. But let's just say you weren't going to plateau. You know how much exercise you would have to do in order to decrease the time? And it would still be very, very long, because 2 days of not fasting, that's a 4,000 calorie deficit that you are demanding your body to burn from fat stores. Now, optimally, it would burn it all from fat, but in the beginning, it burns it from various sources. This is why AOD is crucial in the equation, because AOD really gives your body that metabolic flexibility that it doesn't have yet. And so I do want to touch on that. Metabolic flexibility is your body's ability to alternate fuel sources, which decreases when you become more insulin resistant and increases the other way around. So you want to have a metabolism that can alternate fuel sources. So we always talk about carbohydrates being the first source of fuel, which is generally a true statement. But when your body's very flexible and inflammation's low, insulin resistance is gone, you're sensitive, your body can tap into fat really quickly and leave your muscles and liver full of glycogen, or a percentage full, in anticipation of higher intensity workouts, because that's the big difference between burning carbohydrates as fuel versus burning fat. Burning fat can fuel you up to a certain point if we're talking about energy requirements over a duration of time. Once you get into that out of aerobic demand and into anaerobic, which is weightlifting or anything intense or high intense, you start getting into that anaerobic threshold and you need carbohydrates. It's pretty awesome when your body can hold on to some of its carbohydrates in anticipation of a weightlifting session. That gives you much more wiggle room when we're talking about ease and maintaining weight loss and just an easy lifestyle overall. So eating less processed foods, eating less carbohydrates, lots of fasting, and then number 4, numero cuatro, is lots of weight training. Now, it doesn't need to be lots. 3 to 4 days a week, I think, is solid. 45 minutes would do wonders. There's many different styles of weightlifting. Many versions are not that good. Many versions are adequate. And then there's optimal and ideal. Hypertrophy is a term that describes muscular growth. There's a certain way that you train for muscular size and growth versus endurance versus explosiveness or power. You would do very, very well even in a weight loss range, which many people think, well, we train more in that aerobic and more of that fat burning zone. I want to burn more calories. They think getting the best of both worlds is ideal. And if you weren't doing my fasting regimen, we could make a good argument that you need to burn as many calories as possible. And so weight training in this aerobic style circuit is pretty good. With the FLOA protocol, you don't need to worry about burning more calories. And you get to take advantage of the powerful stimulus and hormetic responses created by hypertrophy style trainings. You have no idea what I'm talking about. If hypertrophy just sounds like a crazy term, then you would do really well by getting a personal trainer. I strongly urge you to consider 5 to 10 or more sessions, not for the sake of having them put you through a good workout. That's what they're going to do. They're going to get your endorphins all pumped and high. You're going to feel really good, and they're going to tell you to buy more. And that's up to you. If you can afford a personal trainer, it's an awesome investment. But make it very clear. Go to the gym, talk to the personal training manager, especially if you're on a budget. Say, hey, this is an investment. All I can afford is 10 sessions. I really appreciate it if you could put me with a good, knowledgeable trainer. Now, if you have injuries, this is also very, very important. Because if you don't ask, they'll just put you with any personal trainer. So make sure you ask for a knowledgeable trainer, more on the injury side. If you are dealing with injuries, geriatrics, if you're older, they do have specialties. You don't get what you don't ask for in this case, in life too, actually. And really let them know, look, I need to learn. I don't know what the hell I'm doing. Like, I look at the gym and I get overwhelmed. Let them know what your struggles are. Are you overwhelmed? Are you excited and not overwhelmed and not anxious, but you just literally don't know what to do? Or do you actually have some anxiety and feel overwhelmed? Do you feel intimidated? Are you working around injuries? Let them know. They'll find the perfect trainer and really go there and learn how to use the machines and the free weights. Let them show you a few structured programs, because you can learn about what a set is and the weights and the reps and the tempo. And you need to learn these things, the language, but then putting it all together into a program. All this information's free. You don't need to pay anybody for this stuff, guys. So I'm not telling you to go hire a trainer to teach you how to structure these things. You could literally find this information on Google and using artificial intelligence, AI. But the physical demonstration for your body is invaluable. And that's where the investment comes in, and I think it's huge. But besides that, you want to be structuring a regimen 3 to 4 days a week. You could do upper, lower. You could do full body every time, but focusing on compound exercises, meaning exercises that stimulate the most amount of muscle, that require the most amount of synergistic muscle contraction. So think basically anything lower body. Yes, anything lower body, because your quads and hamstrings, even though that if you do a leg extension or a leg curl, technically that's isolated, but those muscles are so big. But yes, compound would be squats, leg presses, lunges, things like that, deadlifts. If you're again have a body that can tolerate that. And then upper body, think pulls, pushes, rows, and what you could stay away from. You don't have to. I like big biceps. I do bicep curls, but if you're limited on time, it's those isolated exercises that you should do at the end, if at all, and focus your effort towards the compound movements. You would do really good with this. You'll stimulate the most amount of muscles. You'll get the most positive hormetic response. And then consuming adequate protein, which kind of goes back and forth between nutrition and weightlifting. But a simple formula for adequate protein consumption is your current weight, between your current weight and your target weight in grams of protein. This is a good range, a good target for protein intake. And don't put in all this effort for weight training if you're not going to get out there and eat enough protein. Ideally from whole food, but absolutely supplement when you need to. This will make a big difference. Some of these other topics that I'm going to touch on, I have other videos that you can dig into for more information, are not only contributing as well to helping your insulin resistance and inflammation, but there's a concept that I want you guys to understand. Focusing on optimizing your health. If it optimizes your health, it improves lasting weight loss. What do I mean by that? Anything that improves your health will improve your ability to maintain weight loss. Maybe not directly, and that's the part where people get stuck. But if it helps your health, it is almost guaranteed to put your body into a state where maintaining weight is going to be easier. And that's what we need to understand. And that's where functional practitioners understand this concept. And they're just light years ahead of standard Western medicine allopathic practitioners, who are stuck in a model focused on drugs and surgery. So a good supplement protocol is huge, because micronutrient deficiencies cause all sorts of different problems. Rapid firing for you guys, 5,000 IUs of vitamin D in the morning. I like magnesium glycinate in the morning, maybe about 100 milligrams or so, magnesium threonate You could do 100, maybe 140, 150 milligrams in the evening. Essential fatty acids, fish oil. You could do algae if you have an intolerance, but 2 to 3 grams a day. About 1 gram of EPA DHA total content. I'll list to my favorite brands in the description. And then a good multivitamin B complex or a greens product. There's so many more supplements after that I could talk to you about. And I'll make, again, separate videos on all the situational supplements. But those 4, you would do really good. Most people, these are essential. Well, all humans, these are essential, but there's many more afterwards that are also essential for individual situations, especially if you have like an autoimmune disease. This is definitely worth mentioning. Not only should you incorporate curcumin and resveratrol, because curcumin and resveratrol are, to what I believe, the most potent supplement anti-inflammatory stack in existence, and I don't say that lightly, but low-dose naltrexone is the most powerful anti-inflammatory period option for anybody with an autoimmune or inflammatory condition. So naltrexone is an FDA-approved medication, but low-dose naltrexone is very popular in the anti-aging space, and essentially it's just using it off-label at a much lower dose. And what it does via very magical mechanisms is it modulates the immune system, so it calms down an overactive immune system, and it massively reduces inflammation. And this is what you need if you're in an autoimmune situation. Also, if you are struggling with autoimmunity, your diet might have to be more strict. In many cases, it does. Gluten is probably bad for most people. It's very bad if you have celiac disease, but non-celiac gluten reactivity, there's some controversy over that, but I've seen so many cases improve with reducing gluten. But how sustainable is that? And so for me, let's follow the principles that I talked about. Let's go 90% clean, and then let's go more strict if we need to. Just putting it out there that if you do have an autoimmune situation going on, you might need to be even more strict on your diet side of the equation. And this is why I have coaching platforms, because we can help you figure all that out, help you make sense of all that. If you guys enjoyed this video, check out this video here. It is a podcast interview I did where we took a deep dive into the various components of our program and how we approach the peptides and the GLP-1 medications. We'll see you guys later.